بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about normal wrist. The wrist consists of bones, and we will discuss the distal radius and the distal ulna and the carpal bones. The carpal bones, there are 8 in numbers: scaphoid, lunate, triquetrum, and pisiform, and hamate, capitate, trapezoid, and trapezium. The distal radial articular surface tilts about 17 degrees toward the ulna as in this line. Medially, the radius articulated with the head of the ulna at the ulnar notch here, and the head of the ulna may be about 2 millimeters shorter than the radius. The width of intercarpal joints is uniform and about 2 millimeters. There are 3 arcs should be traced. The first one along the proximal wall of the carpal bones, proximal aspect, and the second one along the proximal wall of the carpal bone distal aspect, as we see here in the middle, and the third one along the capitate and hamate, capitate and hamate, capitate and hamate approximately as in the third line. These 3 lines should remain unbroken. So we have 3 arcs should be not broken at the proximal carpal, at the distal proximal carpal, and the capitate hamate proximally. And the distal radial epiphysis line may remain as a linear density with sphere-like projection, as we see in this X-ray here of the distal radius, likely projected laterally, simulating a fracture, and it is due to simulating a fracture due to break of the cortex, and this is normal variant, should be not mistaken with a fracture. The distal articular surface is angled about 10 to 15 degrees anteriorly, and this is useful when identifying subtle fracture at the distal radius with the flattening of this angle. Articular surfaces of the radius, lunate, and capitate should be in a straight line and be congruent parallel. The apple is the capitate here, should sit on the cup. This is the lunate, and which is should sit in saucer of the radius. So linear line parallel to each other cavitate, lunate, and radius. Cavitate the apple and lunate the cup, and the radius is the saucer. Thank you very much for listening and hoping to see you soon in another talk.